And welcome to the Dr. Vincent Buscemi podcast, the jaw-body connection. That's the unofficial term, but I think I'm going to change the podcast to that name. We'll see. Something crazy is happening in my life. A couple of things. First, my kids are 2 weeks away from getting out of school, which is nuts. We have to find things for them to do. But the second thing is, the more I'm posting podcasts and I guess these little PowerPoint presentations about the jaw-body connection, the more and more people are reaching out to me with either opportunities to collaborate with other professionals. So I had someone reach out to me to collaborate with a chiropractor, to collaborate with a physical therapist, and then a good friend of mine who goes to Creighton University Dental School referred me to this website for basically this is the jaw-body connection. It's run by two physical therapists, optometrists, and a dentist, and it talks about the right way to move your body. And it's a lot about occlusion and sleep apnea and jaw development. It's crazy. I think I'm on the right path. I want to bring up a couple of items before we get rolling into tongue size sleep apnea and why there is not always a direct connection between the size of your tongue and obesity. Because I'm finding more and more patients who are young, mid-30s, in really good shape, not obese, but have huge tongues, which could contribute to their sleep apnea. So I had a patient the other day. This patient was actually late 20s, and they came in. I've known them for a while, and they said, my tongue's getting bigger. And I was like, if I would have heard this 5 years ago, I would have thought this person's crazy. But the more I learned from Felix Liao and whole body health and the tongue and autoimmune disease, I asked them if they had been recently diagnosed with hypothyroidism. And again, I'm not a physician, but just a question. I'm a person with a brain. And they said yes. And I asked them, what was the steps leading up to this? They started having trouble sleeping. They had trouble keeping the weight off. They were fatigued. These are all symptoms of sleep apnea. They were having cold hands, cold feet. And all of a sudden, they get their thyroid levels checked, and they are hypothyroid. And definitely there is a connection, and we'll go into that, between hypothyroidism and tongue size, which is crazy. And another thing I'm noticing, I've only been out of school for 11 years, with school 4. So in my 15 years of interacting with the public as a healthcare provider, my patient's health is just worse. I just see more and more unhealthy people with really long lists of medications, both physical and mental health. Everyone's on antidepressants. I'm being hyperbolic here. Everyone's on anti-anxiety. Everyone's on cholesterol, blood pressure. Everyone's on at least 10 to 15 drugs, which is scary. Their health is awful. So you come in here, you fix a tooth, which is great, but then the rest of their health still suffers. And I think a big component of this, the more I'm learning, is this jaw-body connection. So let's dive into tongue size, sleep apnea, and what you need to know. All right. So tongue size and sleep apnea. This is so crazy. I put this 2024 meta-analysis into ChatGPT, and I said, create a infographic I can show to my followers on my podcast and YouTube channel about everything. So tongue volume, the size of your tongue. We're going to find out in this presentation. There's two main reasons. Well, there's a lot of reasons, but two main reasons we're going to talk about. One is just your overall weight, obesity. When you gain weight in your body, your tongue also gains weight, which it gets bigger. It becomes more fat in your body. And the bigger your tongue, the more at risk when you lay back. See, on the screen it says caudal displacement. Basically it means it's getting pushed back and down. So your tongue is basically suffocating you. The bigger your tongue is, the more fat that's in your tongue. But you could have so look at it this way. I have some really in shape, thin people in my office that are at risk or if not have mild sleep apnea. But the reason they're getting away with feeling decent is that they're really thin and really in shape. if you have a deficient maxilla, so your upper jaw is small, narrow palate, it pushes back your lower jaw. Even a somewhat normal sized tongue could fall back and collapse your airway. So if you think about it this way, the mouth is getting smaller, which leaves less wiggle room for any weight gain and less wiggle room for a larger tongue, which will just fall back and basically suffocate you while you're sleeping. So that's why a CPAP works, because you put a CPAP, well, I should say temporarily works. You put a CPAP machine on and it just blows air and opens up your airway. It forces it in. So what is sleep apnea? There's two kinds. There's central sleep apnea, which I have no business even talking about. All I know about central sleep apnea is that something in your brain causes you to not sleep at night. That's all I know about it. And there's obstructive sleep apnea. So something is obstructing your airway, getting lack of oxygen into your body, into your cells, and slowly killing you, ruining your health. If you look at sleep apnea and comorbidities, so what diseases are related to sleep apnea? It's all of them. Increased risk of diabetes, increased risk of cancer, increased risk of heart disease, increased risk of mental illness, terrible things. So tongue, like I just said, your tongue will block your airway if it's too big, causing you to snore or causing you to have sleep disorder breathing or mild to moderate sleep apnea, or even severe sleep apnea. So one of the first line of defense is weight loss. And I got to tell you, this is a very sensitive topic for any healthcare provider to tell their patients. I would argue it's even more difficult for a dentist to talk to their patient about weight management. It's much easier for me to tell them you have a bunch of cavities because you eat really poor food. If you stop eating processed food, you'll get less cavities. That's easier because cavities aren't as socially stigmatic as obesity. But the research shows, this is just scientific, it's not my opinion. The more that you weigh, the more overweight you are, the more your risk for sleep apnea, which leads to a lot of comorbidities. So maybe 10 years ago, a study came out where it talked about there's two types of fat in your body. There is visceral fat and there is, I don't know the exact terms. So there's fat that's not on your organs and there's fat that is on your organs. One's called subcutaneous fat, which is just like fat under your skin, which really doesn't have that big of a metabolic impact on your body. But the other fat, which is called visceral fat, which is the fat on your organs, has a huge impact. And there has a large correlation between that kind of fat and disease. However, what wasn't mentioned in that study is the correlation between subcutaneous fat, which is supposed to be the healthy fat or the non-bad fat, and sleep apnea. And the more any kind of fat you have in your body, the higher risk of sleep apnea. So I don't want you to think I'm just some regular general dentist calling you fat and you lose weight. But in terms of health, it's super important. And whenever I bring this up, people ask, well, where do I start? I'm going to go actually further down this presentation right here. You should read the book, The Circadian Code. I talk about this book all the time, but the main thesis of this book is that health starts when we think about when we eat, what we eat, and how much we eat, and also sleep and move. So although a paleo diet is important, a non-processed diet is important, it's also really important when you eat, when you sleep, when you move. So you have to think the clock of your body needs to be synced to the clock of the world, the sun, the universe, our environment. That's a better way of saying it. And the more in sync you are with the environment, the healthier you'll be. So where do you start? Basic guidelines on this. Number one, if you can, 10 minutes of sunlight before 10 a.m. Look at the sun. I just did it this morning 5 minutes ago. 10 minutes of sunlight. Another good point would be stop eating 3 to 4 hours before bedtime. This is really difficult if you have any form of social life. Me and my wife went out to dinner for my birthday on Friday, and we finished eating at 8 and went to bed at 10. And then I had some indigestion the next morning. But I find that if I stop eating at 4, 5, I go to bed about 9:30, I feel great the next morning. So really try to push up your dinner if possible. And try to get as much sunlight before 10 a.m. as possible. And also try to limit or eliminate artificial lights after the sun goes down. I think if you're really struggling with weight, this is a really good place to start. I think if you start with caloric restriction or crash diets or a low carb diet, I think that will work temporarily, and then your weight will go up and your health will go down. Read the book Circadian Code, and that will get you back on track for weight loss. And this is not me judging you. Currently I weigh 180. In dental school I got all the way up to 240, 230. So I used to be a big stress eater, but the more I sync my internal clock with the environment's clock, the healthier I am. So weight affects tongue size. But there's something else which I spoke about, hypothyroidism. So right here, I had a patient last week come in, again, young girl, mid-30s, really good shape, hardworking business owner, very health conscious, thinks about health the same way I do. And she asked me, is it normal to wake up with your tongue between your teeth? And I was like, what do you mean? Like you're biting on part of your tongue? She goes, no, my entire tongue is so big that it's between my teeth when I wake up. So look at this article, The Association of Tongue Scalloping with Obstructive Sleep Apnea and Related Pathology. This is not my patient, but my patient's tongue looked just like this. And I really want you to look at this photo. And you can see how there is scalloping on the sides of the tongue. What caused those grooves in the tongue? Your teeth. So the tongue in this person's mouth is so large that when the tongue is in the mouth and the mouth is closed, it's pushed up against the teeth, causing these indentations or scalloping. And independent of weight, which means people that are not obese, if they have this scalloped tongue, that is a risk factor for sleep apnea, even if they're in really good shape. So I want you to look at the sides of your tongue. Are they scalloped? If they are, it's an independent risk for sleep apnea. So I find this crazy. Why would hypothyroidism cause a large tongue? I had to look this up. So it turns out when you're hypothyroid, your body collects what's called mucopolysaccharids in your tissue. And that mucopolysaccharids, and we'll go into what those are hydrophilic, meaning they love water. They're philic towards water. So water is attracted towards these mucopolysaccharids, which causes tissues to swell. So this is one of the reasons why people who have hypothyroid complain they're gaining weight, complain their face is puffy, complain everything's puffy, their tongue swells. So it may not be fat deposition in someone's tongue with hypothyroidism, but it's swelling from the mucopolysaccharids and water swelling, which again leads to larger tongue, obstructive sleep apnea. So a mucopolysaccharide, now more commonly called GAGs, are long chains of sugar molecules, polysaccharides, found in the body, especially in connective tissue, cartilage, skin, extracellular matrix. They draw water in. So here we go, right here. They are negatively charged due to sulfate and carboxyl groups, attracting water and forming gel-like structures. They provide structural support, lubrication, shock absorption, tissues. So they're good, but in excess, they're not good. So if you have a large tongue, scalloped tongue, you're not obese, I would go to your physician and get checked for hypothyroidism. So what are the common signs of hypothyroidism? Fatigue, weight gain, cold intolerance, depression, dry skin, muscle weakness, brachycardia, which is slow heart rate, because tachycardia is fast heart rate, constipation, puffy face, macroglossia, which is big tongue. If you read all of these symptoms, that could be a symptom of being an adult that works and has kids. But it's very important. If you have hypothyroidism, there are other downstream effects too. But if that's making your sleep apnea worse, less oxygen, less restorative, health will decline. So again, circadian code, these are your next steps. In the circadian code, they also talk about healing autoimmune diseases. These are all just symptoms of, in my opinion, your internal clock not being synced with the environmental clock. And when you have poor sleep, you're just throwing your clock off more, throwing your sleep off more. So if you, in conclusion, in summary, for my book report today, if you have a large tongue and it's caused by weight and you're not hypothyroid, I would buy the book, The Circadian Code, sync your clock with the environment's clock, and you'll watch your weight go away because your food cravings will go away. You'll have more energy and just feel better. If you're not overweight, but you have a large tongue, scalloping tongue like this one, I would still read the book, The Circadian Code, and sync your clock with the environmental clock. But I would also contact your physician and see if you do have diagnosed hypothyroidism. All right, guys, I really appreciate you guys listening. The more I'm gaining ground fast, people are reaching out to me. People want this treatment done. And I'm actually this Thursday flying out to Virginia to go see Felix Liao to start more training to becoming an airway mouth doctor, which is a general dentist that treats deficient maxilla. Thank you so much for listening, and I'll talk to you guys soon. Bye.